One word. Magnificent would be the word I'd use compared to all our other anchors, for sure. So my name is Steve Roser. I'm an orthopedic foot and ankle surgeon in Boise, Idaho. Well, what drives me as a surgeon, especially foot and ankle, is always seeking to find better results for my patients. Foot and ankle tends to be less precise than some of our other surgeons, knee, hip, shoulders. And so my drive over these last 25 years has continue to develop better and better product so that we can have better outcomes for every patient we treat. So when I was introduced to SupraFusion a couple of years ago, I recognized that this particular technology I could use just about everywhere in the foot. Where I have really come to use it on a daily basis is lateral ankle reconstruction, or tightening up of the lateral ligaments so that the patients can have a sound ankle that's stable for them to return to sport. I previously have been using all types of anchors. Started 30 years ago with metal anchors, came down to some PEEK anchors, some other plastic-like anchors, some all suture anchors, all of which had a lot of difficulty with them and all of which left a footprint in the patient, if you will. Some of which caused issues, some didn't. So when I was introduced to SupraFusion, I recognized that I could place this in weaker bone, that it would resorb over time for the patient and only be left with a stitch. And that became extraordinarily appealing to me, particularly how small a hole we can start with to then introduce these anchor sizes. So not only the smallness of the anchor, the strength of the anchor, and then as a bonus on the back end, those anchors would resorb over time to just water and carbon dioxide. So it's changed in that as I continue to use the anchor system, I recognize there are more and more places in the foot that I can actually utilize that anchor. For instance, I've been able to utilize that anchor in hallux varus procedures of the great toe, so a failed bunion, if you will. But I can see utilization on a daily basis. Since I'm familiar with the current anchor system, I know I can expand that around the entire foot. And I've been using it with tapes and in a lot of different places, whether that's Achilles, tendon transfers, that type of work. One word. Magnificent would be the word I'd use compared to all our other anchors, for sure.